Hi, this is Bill Johnson. I'm Director of the Acute Surgical Pain Management Fellowship here at Middle Tennessee School of Anesthesia. This is the orientation module component. This is the very first module that you'll see on Brightspace. So this is an orientation to the content. We also, I wanted to outline expectations of the program. What are things that MTSA could possibly help you with as we go through this program? And then the other component I wanted to, and probably the most important component, is that we get you navigated through the Brightspace environment, the online learning environment. So just to tell you a little bit about myself before we get into kind of the meat of the topic here with the orientation module. I've been practicing anesthesia for about 18 years. I graduated from Texas Wesleyan University in 1999. I trained out in San Bernardino, California at a county hospital there for a period of about 2 years, where I began doing some nerve stimulator techniques in regional anesthesia out there. So from there, upon graduation, I moved to St. Louis, where I began working in Barnes Jewish Hospital, which is a 1,200 bed urban trauma center in the middle of St. Louis. And I was really fortunate to continue on doing nerve stimulator techniques in regional anesthesia. As you know, back in that day, we didn't really have ultrasound yet, so we really relied on landmark-based techniques for anesthesia and using that nerve stimulator. So I got to do some really unique kind of techniques there in St. Louis. One of those would be the cervical plexus block, which I'm going to be doing within the module under intervention. So in addition to that, we did a lot of orthopedic nerve stimulator blocks at that institution. So from there, I spent about the next 12 years kind of floating around Missouri a little bit. I worked as a hospital employee. I've also worked in a private group, and I did some 1099 contract work throughout the state. Even on some locations, I was the sole provider at some very small community type hospitals. So I got to continue on with that nerve stimulator guided technique, kind of bridged a little bit of the gap into ultrasound guided regional anesthetic techniques, but it hadn't really come on as a big technological advance at that time. So where I really gained my experience in ultrasound guided regional anesthesia was down in Fort Worth, Texas, where I took a position at John Peter Smith Hospital, which is another urban trauma center in the middle of Fort Worth. And I had the fortunate opportunity to join an acute pain service there with 6 other CRNAs, and all we did 1 to 2 days a week was acute pain. So it was nice to just focus in on learning and advancing my ultrasound guided skills, developing techniques or knowledge that I needed to run an acute pain service where me and another CRNA, along with a physician, would run this really busy advanced pain service. So because we were a trauma center, I got a lot of experience at truncal anesthetic blocks, and really stayed busy for that period of time that I was there at JPS. So from there, last fall, in addition to, I would say in the 3 years that I was there at JPS, I got asked to come over to Texas Wesleyan University and do some lecturing for the entry-level students there for a couple of years. So I gained a little bit of an education background, finished my doctorate there at Texas Wesleyan University while I was educating those students, did some symposiums on ultrasound-guided regional anesthesia, a little bit of stuff on airway ultrasound, which was kind of nice, and worked my way into a little bit of the education aspects as I was continuing to practice clinically as an anesthesia practitioner. So I got a phone call last fall to come and help continue some of the good work that Dr. Hewlin, the president here of MTSA, began, and Dr. Patrick Moss with the Acute Pain Fellowship. So I started here at Middle Tennessee in November and have brought on a faculty that I'm at this point really impressed with, and we can go into a little more of that as I talk about the curriculum in this next section of the video. So this is the second part of this opening video for the orientation module. I want to talk a little bit more about the program specifically. We have brought together, I think, probably some of the finest faculty in the country that are subspecialty experts in their field. We have 25 faculty members from all areas of different specialties. We have anatomists, we have physiologists, we have pharmacists, we have pedagogists that will give you some ideas to the education component to the fellowship. We also have business people. We have people that are experts on public policy, some of the business aspects of running an acute pain service. So I'm truly cannot be more pleased with the faculty that we brought together for this fellowship. The clinical CRNA faculty alone are premier. We've gathered and recruited CRNA faculty that are the top educators in their field. They own anesthesia education companies that specifically teach regional anesthesia, so their knowledge and their ability to organize and present information in a very learnable way is an asset to our fellowship. So being that it's a multidisciplinary, we brought many different people from various fields together. I think that the content as we move forward will enrich your acute pain service practice. So the program is essentially, as you know, reading in the handbook and before you applied, is divided into two separate parts. One is the didactic component, which is 7 months of online learning with our various 25 faculty that I just got done mentioning. The second component is the clinical aspect to this, and this is where you get that clinical exposure experience, participate in our cadaver lab. I come to your facility and give you some tips and tricks on placing blocks. You do your clinical rotation sites at that time as well. So the program is, I think, unique in that aspect that we have an online component that melds with the clinical component. So as we move forward, I feel like we have some major goals that we want to accomplish with this fellowship, and one of those is to take the CRNA and make them into a super user where they could get out, pretty much know the area of acute pain management at an expert level and teach other CRNAs and other anesthesia staff these principles of multimodal therapy and regional block anesthetic techniques to advance this acute pain service. So this fellowship is just not about learning blocks, although the second course within this fellowship, as you can see from the curriculum map, contains over 50 blocks. A lot of those are variations of the same block. The fellowship is focused in on interventional management for pain, but I do want you to know that we are focused on other aspects, neurocognitive, psychosocial impacts that we can have on patients, and applying multimodal analgesia to patients before they enter the operative process. We hope to reduce this overall opiate consumption that we're trying to tackle. So the other goals that we have for the fellowship is that you come out and you're able to go into a hospital or some kind of practice and actually establish an acute pain service, know the protocols, who are the right people to talk to, what are the business aspects of that, starting that acute pain service. So bundled together, we're going to make you a super user. We're going to make you knowledgeable about the content of acute pain management, and then give you some of the business principles that you're going to need to further advance acute pain services in various hospitals. So I wanted to conclude this with saying I really appreciate your dedication, and I'm very humbled and honored to be in this position of providing collaboration in this endeavor in the fellowship. So I look forward to the next year. I really do stand on the shoulder of giants in this field. I just really am a collaborator, and I, like I said, truly honored and humbled by this experience. Our ultimate goal, I think, with this fellowship, from a patient perspective, is to reduce the overall opiate consumption that occurs in that surgical patient population. So, and we know that with opiates, there is a tremendous amount of complications associated with it. So if we can reduce that, we also know that certain surgical pain patients that come into the hospital, if they end up with a very severe level of postoperative pain, this pain can develop into a chronic pain type situation. What we're trying to do with this fellowship is avoid or reduce that severity of postoperative pain so we can reduce the number of patients that develop that chronic pain syndrome. And we know that chronic pain patients as a whole are going to require opiate analgesia. And if they can't get the prescriptions from their physicians for this opiate chronic state, then they will seek drugs elsewhere, whether it be heroin or illegal unprescribed drugs that we obviously like to avoid. We know the heroin crisis is real, and we would like to have as much impact with this fellowship on reducing that crisis in America. And thank you. And we will conclude this orientation module with some screen capture technology, which I'll go through and show you the navigation within the Brightspace environment. What are our policies and procedures specific to the fellowship, and how do you move forward with the next steps with completing through the content for the fellowship. So I'm dedicated here at Middle Tennessee School of Anesthesia to be available to you whenever you need me. So if you're having a difficult time with this fellowship, please reach out to me. I'm available 24/7. I'm only dedicated to the students here within the fellowship. So my phone number is 573-673-6861, and my email address is bill.johnson@mtsa.edu. Again, reach out to me if you need any help.